if you notice that your kid is having ADHD, it's not good to overload them with tasks. Like, do this, at the same time. Because those people are not able to process things at that rate. Their mind is made to like function on one thing first, then move to the next, then the next. They are absent-minded, they daydream, and sometimes, especially for girls, they have very low self-esteem because there are people who can't focus on a relationship, for example, any kind of, even a friendship, they just can't focus. So I'm Catherine Jerry Ndomo. I'm a counseling psychologist by profession. Also a mental health advocate, especially for the teenagers and the children. Yeah.
So our main focus is on ADHD. So if you can kindly take us through what ADHD is and how is it diagnosed?
Okay. So as you know, for those who don't know, the full meaning of ADHD, it's attention deficit hyperactivity deficit disorder. So it's basically a neurodevelopmental problem, mental disorder, which occurs mostly to the children. It usually occurs also to the adults, but not very common. It's one of the most common disorders facing the children, especially under from the age of 4 years old, all the way. For ADHD, it usually mostly affects the parts of the brain that usually help us to, be attentive, impulse control, planning. So whenever someone or a child is going through ADHD, it means they lack these things. They might lack the planning process. Well, the impulse rate, the impulsivity might be high, they might be hyperactive. So that's basically what ADHD is. And the way you can detect ADHD is quite different from the other disorders because, as we all know, young children like to play, they are very active. It's usually very hard for psychologists or even doctors to detect ADHD in kids. But with time, around age 4, it's usually you have to see a pattern that is recurring. For example, a pattern of maybe being inactive, or maybe being hyperactive for a certain period of, a school-aged kid. It's very easy for a teacher to detect if that kid is having a recurrent pattern. And that's how you might be able to know, because it's not detectable very much often, especially with children. As you all know, children love to play and be active. But within the age of 4, if there is a pattern that is occurring with a certain kid, a pattern that maybe might be harmful, that's when you might consider to do a psychological assessment. But this pattern has to have prolonged for 6 months. Yes.
So is there a difference between ADHD and autism in kids?
Yes. For ADHD, the kid is normally very active. It's not like autism. For autism, all of them usually be detected for 6 months range. But for autism, the kid, some kids don't even talk. They don't have that, some parts of their brain are altered, so they don't make speech, they don't show emotions. So some of these symptoms are quite similar to the ADHD ones, especially the emotion part. But in terms of concentration, you might find an autistic child can concentrate and lay their entire focus on something, just a particular thing. But for ADHD, they don't concentrate on one thing. they might be here and the next time they're thinking about something else, or have shifted their focus on something else. They don't have that structure in the brain to focus on one particular thing. And like autism, they might concentrate, but they might stay there for a long, long time. And most of the autistic kids have a really hard time in, expressing themselves. You can know when they're excited or when they are sad. They're just plain, they don't show like emotions as much, and they usually don't communicate as much. Yeah, so I think communication is the major difference between autistic kids and kids with ADHD, because the ADHD kids usually speak.
Okay.
Yeah, they don't have a problem with speech. Yeah.
So does it suffice to say that ADHD mostly manifests in children as opposed to adults?
Yes, it does. For children, you find 5 to 10% globally of that percentage is where the kids usually suffer from ADHD, unlike the adults. So you find most adults who suffer from ADHD, they've come from, the roots kutoka their childhood coming upwards. But it's very unlikely for the adults, as much as there are so many statistics about it. But for the kids, it's very evident. It's one of the most common disorders facing the children, just like autism.
So what are some of the key symptoms of ADHD, and how do they vary with age? Now, the children and also the adults. And also, as you answer that, does it mean that when you are an adult and you've been diagnosed with ADHD, does that mean that you had it when you were young? It's just that it has been diagnosed when you're now an adult.
Maybe I can start with that. It's very possible that it will be detected while you're younger, and it will be detected when you're older. I think that question will go hand in hand with the symptoms. So ADHD in children, it usually have different symptoms. For example, their kids will be very active. That means they won't settle in one place. They will really try to go out of their way. They are radical. They are kids who are also very inactive. And that's why for ADHD, there are two types of ADHD. Okay, there's the inattentive one. Like here you find the kid or the individual going through ADHD is not like focused, They don't have like organization skills. They're just, they don't have like that impulse to do something. They're just, you might see them as lazy. People term them as lazy because they're not going out of their way. They're just there. And sometimes it doesn't happen to kids. It doesn't manifest mostly when you're a kid. So when you're a kid, the type 2 now, the hyperactivity one is the one which is dominant. You see, when you're young, children like being very active. So that's when the ADHD hyperactive one usually is dominant, because at this point, the hyperactivity one, the impulse control is really not there, because they might tend to, do things not thinking of the consequences. Like you might find this kid, like if they're in school, they might be like breaking things and people might term them as careless because they are breaking things. They don't care. They just, they don't mind about the consequences that will come with breaking things. Most of them are usually also termed as maybe rude, because they don't mind anything at all. They are just very hyperactive. They don't have the skill to just be able to concentrate on one thing. They'll be here, the next time they're jumping over the chair, the next time they are painting or doing something, they don't have like a particular thing they have in mind. You get, like every time there's just some kind of a movement, they're not always focused. Unlike the ones who are, there are those who are really focused. They're focused, but once they are done, that's it. So that's what brings the difference between the two. And that's why it's very hard for some people to detect ADHD in a kid, because we all know like kids love having fun. So that's why it might not be detected, and it now follows up to the hyperactivity, and now the impulsivity increases, attention decreases. You find like this person cannot be attentive at all. They are absent-minded, they daydream, and sometimes, especially for girls, they have very low self-esteem, because like there are people who can't focus on a relationship, for example, any kind of, even a friendship, they just can't focus, because for them it doesn't seem like so much meaningful for them, because it's just like you might find them shouting at you or speaking loud than usual, and maybe you might be wondering, why are you speaking loud? But for them, they don't have that control of their tone. They're just allowed, and that's what really makes a difference, and that's how you can't detect it when you're younger until you're older. And then when you're older, now the inattentive ADHD now starts to manifest, start to become dominant, because the the hyperactivity one usually occurs mostly in kids. But when you grow up, it decreases, and the inattentive one starts to become the dominant one. Okay. So most adults who have ADHD, they're very calm. They're not hyper. They are calm but very absent-minded, things like that.
I think you just got ahead of my next question on laziness, because quite often do we term kids who we see with this kind of condition, because I think we are so much misinformed or just ignorant of the condition, so that when we see kids going through such, we term them as lazy or just careless. So it just drives me to my next point. So what are some of the early signs that can be detected at an early age, or what can parents generally look for?
Okay, so parents, I can encourage parents. Sometimes it's good to be very observant, because just like I mentioned, ADHD can mask or can mimic like childhood. It can mimic childhood. What usually happens, those patterns, like the patterns I'm talking about for like focusing, concentration, try to look for, how is the esteem of my child? Is my child having a low self-esteem? As at a young age, you expect a child to be so full of themselves, to be full of life. Like, you expect a child to be active and, loving themselves, because children don't take really a lot to themselves. They just live in the moment. But you might find a pattern that a kid is starting to have. Like, you might find today, maybe the teacher has called you to school that they have done something wrong. For example, they are not focusing in class. They are distracting other people. Let's say, for example, distraction. They are distracting other people. You might find them throwing papers to each other, like maybe not that, and they are making noise every time. Every time they are taken to the teacher, this one has done this, he has broken my pen, he has done this. They have really such kinds of things, very destructive behavior. When a parent gets to see this pattern continuing, like for example, the first week, the second week, the third week, it's not something to just ignore. It's something to now follow up with maybe a psychiatrist or a psychologist, because sometimes these children end up in very harsh conditions. Like for example, teachers, as we all know, especially in our Kenyan system, teachers are supposed to be disciplinarians. So each time this child does a mistake, and they keep doing it, most likely in a Kenyan school, they'll be chased out of school, for example. Maybe they'll be told, you need to like homeschool this kid or transfer them to another school. I think parents should have that urge to keep checking these patterns in their kids. check if the kid is really focusing on their studies. Maybe they're not even performing well. They are performing very, very poorly, like every term. Sometimes it's not about like the kid is not reading or something. They might be reading, but they are not even focusing on what they are reading. Maybe they are reading, but they're focusing on playing outside, and maybe when you take them to play, they now focus on remembering, oh, I have books to read. Maybe they won't spend a lot of time playing. They just don't have a clear mindset.
Let me just cut you short on that before you move forward. So that does, how do you say it? Does it mean that kids who suffer ADHD are more likely to underperform in school?
Yes, they're likely to underperform because, our brain is a really key aspect towards our performances in everything, in school, in work, in workplaces. Like, for example, that aspect of concentration. You can't grasp something if you can't concentrate. If you can't focus on something, you can't understand it. You understand? So for them, they don't have that really great ability to focus on something. Especially the focus thing in their brain, the focus structure in their brain is not really there at all. So like it's very hard for them to focus on something. And that's why it makes it hard for them to perform well. Because right now they can't even think about, maybe the teacher is in class, but they're thinking about lunch. But it's not their fault, They think about how I'm going to get home. And then when they get home, they think about something else, They usually have that kind of a problem. And that's what makes them perform really poorly in school. So it's bound to happen. Performing poorly or underperforming is something that is very common with ADHD kids. Yeah.
How about the adults, just generally, even in terms of occupational performance?
So for the adults, it might really be hard for them to stay in a certain, for example, let's say a workplace. It might be hard for them to like stay in one workplace for a long time. They keep shifting workplaces because they keep quitting. There are those people who are, you might term them as strong-willed. I tend to term them as, they have the guts to like, if something upsets them, they cannot stay there. They're like, oh, I quit, Maybe it's not even something that has upset them. Just waking up and feeling like I don't want to go somewhere, it's likely enough for them to quit a job. They just come and they just say, this is my resignation letter, I've quit. There are those kinds of behaviors. Like you find for them, it's very hard for them to stay in like a one workplace, because I really find these people interesting, because if you don't look at them in a perspective that they are mentally disabled, you might tend to feel like these people are very, firm and courageous, because they say whatever comes to their brain. You see that impulsivity. That impulsivity is the one that makes them to make these rash decisions. They might even end a relationship just like that, because, like, I don't want to be in this relationship anymore. And it's just a beautiful morning. Nothing has happened, but just that impulsivity. And they're like, oh, I want to leave. And they leave. Sometimes they might even leave their own homes and just go somewhere else. I find it very interesting.
That's very interesting.
Yeah.
So what are some of the common challenges individuals with the ADHD face in social situations?
Social situation. Okay, they don't keep a lot of friends. That's one thing, because they're not able to like focus on one friend. They are not those people who will find that you have a certain thing, you just call them, I need you to come to do this thing for me. You just don't call them out of the blues, because they really have that thing of I have something else I'm doing. They don't fear to express themselves. They don't mind, and they don't care if you feel bad or not. For them, they just know that this is what I am doing right now. And sometimes it's very hard for people to interact or be friends with them, because they fear that, like that, direct confrontation. Because people with ADHD have like very firm decision skills if they are really managed, and there are medications for that. You find them very strong-willed, very, very good decision makers, because they don't tend to follow crowds at most times. They have their own path. They literally follow their own path. And also some of them don't really do well in relationship, because, they tend to have that kind of, impulsivity a lot of most of the time. They don't have that part of the brain to tell them that we should sit down, have a sit down, talk about this, let's communicate. For them, no, that doesn't work for them. For them, it's just, let me act out of this. So that's why there is usually a lot of behavior therapy to help them to know, in case something happens, we should have a conversation, try to see what should I do. Just don't act out of the blues and something like that. Also, just like I mentioned, it's very hard for them to be able to socialize with people, because they are not able to focus on one thing, not able to focus on one relationship, one person. That how we do best friends things. Usually, they are not people who are consistent. They can't be consistent in that manner. So people end up, not having to socialize with them a lot, because you see, even maybe you go with such a person, for example, to a supermarket. A person with ADHD, when that impulsivity comes, they'll just, want to take things, buy everything, buy things that are even not necessary, you see. For them, they don't see it as a big deal. They can tend to be very extravagant, you see. Someone has lots of money, but they use it doing things that are not necessary. So some of them might end up having very poor planning skills, poor organization skills. They really don't have that as much. And for the females, they really usually, you see, because of that isolation, people don't want to be friends with you. As girls, we like socializing, having conversations. They tend to now have very low self-esteem. And sometimes it now brings about depression, anxiety, especially anxiety, because you want to interact with people, but you can't, because it's like you're chasing them away. So as a human, of course, you're going to feel, oh, what did I do? Later on, you'll be like, oh, what did I do? And then you start thinking, oh, what should I do? You see, night brings a lot of anxiety, because most of the people with ADHD have anxiety as well. You see, especially those who are hyperactive. But those who are inactive, they might tend to have depression, because they don't have anybody to talk to. They are lonely. Nobody wants to interact with them, you see. Yeah.
I'm actually finding all this very intriguing and interesting at the same time, because some of the characters and all the signs and symptoms that you're mentioning are things that we can clearly point them out from our friends. Now that you mentioned that they are characterized to ADHD.
Yeah.
Now that's when it clicks you that, oh, so that friend of mine has ADHD and it's not like they're just acting out of nowhere.
Yeah.
Okay, so how can ADHD overlap with other mental disorders?
I think, like I just mentioned, what usually brings the other mental disorders are the underlying issues of ADHD. Like in the instance that I've just mentioned, let's give like a case study, like an individual with ADHD goes and quits a job, for example. They quit a job, they have rent to pay, they have bills to pay, you see. They don't have another job anywhere, because where they've quit, maybe the boss doesn't have any knowledge about ADHD. And so they're like, oh, you're so ignorant, you're even leaving a job. And then they just let them go. So when they get home, there's no food, there's no money to pay bills, there's no rent, you see. Like that individual will start to feel very isolated, withdrawn. You see, they'll start feeling like everything is not working out for them. And due to this very low, they usually have a very low perception of themselves whenever they are alone, or whenever maybe something has just happened. You see, like, for example, people with anxiety, maybe social anxiety, when they go to crowds, then they go back home, what usually happens? They start feeling guilty of maybe the things they said, maybe the actions they did. Same to an ADHD individual. Maybe when they quit this job, they start obviously asking themselves, oh, when it's really that impulsivity has come down, they start wondering, where should I start? You see, that brings a lot of pressure. And this pressure now brings about these other mental disorders. For example, anxiety, you start feeling worried. For the ladies, because of the low self-esteem, the isolation, they start feeling very depressed, very lonely. I think that's what now brings the other mental disorders into place. However, for the kids, there's also the opposition deficit disorder. It's usually like a disorder for the children who are very destructive. Like, you find a kid, they oppose everything. They are not like on the same page with anything that you say. Like, when you say something, it's just the complete opposite of it. Everything has like an explanation behind it. So also that one usually comes along with ADHD sometimes, and it sometimes can also mimic ADHD. But for the opposition one, it's more like very destructive. Like, the kid is very destructive. Like, they destroy things, they speak harsh words. So like, it's often associated with the hyperactivity one.
Okay.
Yeah.
Now that you've taken us through what ADHD generally means, the signs and symptoms, and what to look out for, I think we can now switch gears to the treatment approaches. So, what are the most effective treatment options for ADHD, and how do they vary based on age?
Okay. So for ADHD, there are certain levels of ADHD that really requires medication. You see, the problem with not having a good plan, or the brain is having low levels of dopamine, might lead to these things, might lead to poor planning. The brain is not producing dopamine at its
What is this dopamine?
Dopamine, it's like a hormone in the body that usually is associated with pleasure and just it's a happy hormone. So sometimes the low levels of dopamine usually make these people to not be able to focus, live in the moment. They're just like, I have to be everywhere at the same time. You understand? Okay. So like medication, there are certain medications that a psychiatrist usually prescribe. But as we all know, like, psychologists mostly don't prescribe this medication. They usually deal with the counseling part. But the psychiatrist usually prescribes some medication that will increase the dopamine levels. You see, so when these dopamine levels increase, usually creates that balance. Same to most medications. All the medications associated with mental health disorders, they are likely to increase a certain hormone in the body. So for ADHD, they increase the levels of dopamine. And then after medication, now that's when a psychologist can be able to do the other part of the therapy part, which includes cognitive restructuring or cognitive behavior. Let's say just behavior therapy. So cognitive behavior therapy is under behavioral therapy, you see. So during therapy, that's what usually works best. The behavior therapy usually works best because it will enable the psychologist to help us to equip the child, or rather the adults, with the skills, like, for example, organization skills. Show them this is what you're supposed to do, because most of them usually don't have that time planner in their mind. So through therapy or through behavior therapy, we are able to show them, like, you should have like a schedule, in the morning when you wake up, what do you do? What do you do at noon? You see, like for them, having a schedule makes it easy for them, because whenever they don't have a schedule, they do what their mind tells them to do. You see, so they might even skip tasks. They might even stay at home and not do nothing at all. You see, so we assist them to like come up with a plan. This is what you're supposed to do, and because ADHD sometimes is not curable, you just have to cope. You just have to manage. It's just like bipolar, schizophrenia, It's not like curable like depression. You just have to live with it. So we help them to accept that I have this condition, and having this condition does not make me different. It just makes me unique, It just makes me more able, to do something maybe that someone else cannot do. So at least when they get to realize that this condition is not living, it's here to stay, we help them understand that and let that sink in first. Because when you have a condition, you'll tend to protect yourself, right? You tend to take care of yourself, because that's the same as people having cancer. When you have cancer, there are things you can't eat. That you have to maintain a balanced diet. Same to these kids. When you get them to know that I have ADHD, it's a condition, it's a neurodevelopmental condition that I have, it will help them to manage better and cope better. Also, we teach them, interactive skills, how can you socialize with people, what to do, just like I mentioned earlier, what can I do if someone is upset with me? Can I have a conversation with them? And we at least try to show them that you can't do things just out of the impulsivity. You just have to plan, schedule, think. You have to think before you act. So that's what behavior therapy is all about.
Mm-hmm. So I think you've just covered some of the coping mechanisms that individuals living with ADHD can use.
Yeah.
Are there other mechanisms that you would recommend for them?
Okay, I would say they should practice a lot of meditation. I don't know how people take meditation. I don't know how people, because there's a friend of mine, I told her about meditation and she was like, does it really work? Because for meditation, it usually helps these ADHD kids to have like a relaxed position. Because when you're relaxed, you're able to think clearly. You see, so like meditation for these kids means like there's usually a lot of meditation apps that parents can use for their kids, especially if you're a parent, that your kid is having ADHD. There's usually that kind of an app that you can use for. There are free apps on the Play Store that I usually recommend even my clients to use sometimes when they're having like a mind that is not settled, because meditation usually helps you to breathe well, feel every part of your body, and whenever you relax, you're able to focus. So that's where ADHD comes in, because they don't have focus. But when they practice meditation, it brings that focus back. Breathing techniques. There's usually the breathing techniques, the meditation, try to make a schedule for them, because most people judge them because they term them lazy, they term them forgetful. For example, it's your friend and they totally forgot about your birthday, for example, and they're like, and you're so upset at them because you say like, how can you forget my birthday and I always remember yours? And maybe they remembered last week, but today they are not even pretending. They don't remember your birthday at all. Sometimes it's good to like be very patient with them, because try to show them that there's a specific day. This is what happens. If they are your close friend, you can show them. You can write somewhere for them. This is when my birthday is. Try to like let there be an indication. You see, if it's a colleague you're working with and they have ADHD, make sure you have like a work plan. You're the one coming, at the reception on Monday, 8 a.m., let them know the exact thing they are doing. Because if it's just coming to work, they might wake up one morning and not even come to work. But through a lot of therapy, through behavior therapy, they tend to usually adopt that schedule. You see, yeah, I think planning usually works so much for people with ADHD, and also meditation, just to help them to focus, relax. Yeah.
You've mentioned how friends or just work associates can help or can work together with people with these conditions.
Yeah.
Does the same apply to family members as well?
Yes, family members, especially family plays a very big role in every client's, may it be bipolar, anxiety, ADHD, autism. You come from somewhere, you understand? Like parents, guardians should be very, very observant of the kids, especially the kids, because sometimes I feel like the mental health of the kids is really neglected, you know? The adolescents as well, very neglected. But what usually happens is that for ADHD, it's very difficult to detect, even as a parent. It might be very hard for you. Sometimes that's why parents are usually advised, if you see a pattern continuing, make sure you just seek advice from a professional, because that professional can be able to be observant and see how long has this been happening. You see, they'll be able to identify that. But this schedule, this planning should even go to the family members, because children mostly live with their guardians or their parents, or their siblings. So it's important for them to, like, if it's a work, maybe you're planning chores, make sure that they know this is what I'm supposed to do. I'm supposed to wash dishes. Okay, I'll wash the dishes, you see. Because not giving them a specific plan usually alters their functionality, because it's like you're confusing them, because they wake up, they find dishes are dirty, the house is not clean, there's nothing that has been done. The most likely thing they'll do is leave the house, because they don't know what to do. It's like giving them a lot of chores at the same time. Also, it's very important for parents, or even parents mostly, if you notice that your kid is having ADHD, it's not good to overload them with tasks. Like, do this, at the same time, because those people are not able to process things at that rate. Their mind is made to, like, function on one thing first, then move to the next, then the next. So whenever you bombard them with, like, everything they're supposed to do, they'll not do it at all. And then you'll term them now as lazy, because you just find everything is not done, and they're seated or they're watching TV or even playing, and then you'll be like, why have you not done the work I gave you? And they're like, I didn't know where to start, or maybe they won't even speak, just maybe, because they really have that kind. But I feel they're really strong-willed, because you can't just throw everything to them and expect them to do it. They don't have that kind of capacity to do it that way. They have to have, like, a specific thing they are doing. Yeah.
Very interesting. I think we've wrapped up most of the important questions. But before I ask you for any additional information, just for purpose of clarification, if at all you mentioned it earlier, in terms of therapy, you mentioned behavioral therapy is the best recommendation for people with ADHD condition. So is there a specific time period for the sessions, and do you also prescribe medicines for them?
Okay, for psychologists, we don't prescribe medication for every of our clients. We usually work hand in hand with the psychiatrist, because the psychiatrists have that medical part of, administering medicine, they can be able to, like, give medication. But for us, after the medication, we work hand in hand. Sometimes therapy has to be there, medication has to be there for therapy to work, and therapy has to be there for medication to work, because I'll tell my clients, there are medications that you've been given. How are you? How are the medications taking you? Are they giving you any side effects? Are they altering your behavior? You see, so like they work hand in hand. But for psychologists, most of the psychologists, especially counseling psychologists, don't give medication. They don't prescribe medication. They mostly work with therapy only, psychotherapy alone. But sometimes there are clinical psychologists who can prescribe medication. The clinical psychologist can. And what other question did you ask me?
No, that was just basically it.
Yeah.
The time period for the session.
Oh, the time. Okay, for the therapy, every client has their own number of sessions. It's very beautiful how all of us process things differently. So for me, for example, I have ADHD and you do have ADHD. Maybe for me, it's easy for me to go maybe for 5 to 10 sessions and I'm good with planning. For maybe you have to go for another 5 additional sessions for you to get well into planning. So sometimes there's no specific number of therapy sessions that one can attend for you to get better. Like it depends with when you will get better. It might go sometimes, it might really prolong. It might prolong to even 15 sessions sometimes. Because the main aim or the goal is for you to know how to plan, how to cope with your disorder or maybe something that is bothering you. Sometimes therapy is also good for them to unwind. They might come for therapy just not to even be told this is all you're supposed to do. But for me as a therapist to say, how since we started planning, how has it been going? You see, have you been having challenges? So this is what will help me to know, like, if my client is really getting the idea of planning, focus, And I think therapy can prolong because even after therapy, there's always follow-up. Because you see, ADHD is not like you're curing it, you're just managing it. So it might also have like a relapse, just like alcohol abuse or substance abuse. May end on a patient up to like they have recovered, they have gotten to rehabilitation and they are well, they have gone outside, but just a small trigger and they're back to, the rehab. It's very possible even with ADHD. They might move so many steps ahead and then it reaches that point, the parents calls you and they're like, oh, you told me my kid would be okay, but now they have broken the glasses at home. They are not even calm. You see, it's very normal. So that's where therapy is told. Like therapy is a continuous process. Yeah, and it really requires a lot of patience and the parents being able to like work collaboratively with the therapist, be able to see if they relapse, this is what they should do. If they relapse, make sure the therapist has known, oh, there was a relapse. So how can we prevent this relapse? Maybe it's someone who has triggered them. Maybe it's someone who has angered them. Maybe maybe it's the environment. Maybe the parents wants them to move from somewhere they didn't want to move, So at least they'll be able to talk about how to prevent that relapse. Yeah.
Here's a real question because I'm really curious. What's the difference between a psychologist and a psychiatrist?
So a psychologist mostly is, let's say, okay, let me give you like the most simple definition. A psychiatrist is mostly like a doctor. It's like a doctor, but a doctor who has specialized in mental disorders. You see, it's mostly like just a common doctor, but they have knowledge about the mental disorders. They know this person is going through depression, anxiety. A psychologist is not a doctor. They don't go for, I think, 6 years or so. A psychiatrist might have gone for 6 years in school. A psychologist just go through normal 4 years, a degree course, just a normal course. But the difference becomes like for us, we deal with issues that surround the client. For example, the social issues, emotional issues, mostly not the physical issues. You see, like I have a headache. You see, for us, we don't focus mostly on the physical issues unless the mental issues start manifesting physically. For example, like you see for panic attacks, whenever a client comes to you, they're having a panic attack, they have physical manifestations, like for example, chest ache, headaches, shivering, numbs, you see, numbing of the feet and the hands. At least that we are taught how to detect this is panic attack, the mental disorder, the mental health. Exactly, the entire realm of mental health is what creates the difference, because for the psychiatrist, they're doctors, but focusing mostly on the mental disorders, you understand?
Mm-hmm.
But the psychologist focusing on the mental disorders and the issues surrounding what is bringing this mental disorder. So that's where the psychologist gets in. They want to know, what can I do? How did this come to be depression? Because the psychiatrist will always give us, for example, let's give an example. I worked at Madare. Once the client arrives, the first person they see is a psychiatrist, because they are shouting. Maybe it's bipolar. They are shouting. They don't want to settle down. You see, maybe amefungwa na kamba or something. So the first person they meet is the psychiatrist, because the psychiatrist has that knowledge of seeing. They are able to like do an assessment and know. You see, like the way you go to a doctor, no one keeps running. So for the psychiatrist, what has been happening? And then they just assess. Once they have assessed, mostly the psychologist is just here, wanakonga, just adjacent to each other. So whenever they whatever assessment they make, they usually refer them for psychotherapy sessions. So for the psychotherapy sessions, now that's where the psychologist comes in. They now take the client. So the psychiatrist has said that this client is suffering from bipolar. So as a psychologist, we are trying to know what to do with someone with bipolar. What to do? How can I solve this bipolar issue? How can I help them cope? So that's where the psychologists come. So these psychiatrists mostly don't have a lot of knowledge about counseling.
Mm-hmm.
They're just doctors. They don't know what is facing this client. So most of the time, even for the patients at the ward, for example, in Madare, at the ward, for them to be discharged, the psychiatrist and the psychologist have to work hand in hand, because the psychologist is the one who's going to have the sessions with the client. Later on, they will tell the psychiatrist if the client is stable. Do they need to go home? Do they need to be given medication? You see, such a thing. Yeah.
Mm-hmm.
I think that's the major difference between us and the psychiatrists.
That's very well explained, and it has broadened my understanding. So as we wrap up, is there any additional point you'd like to add that you feel like you left out?
Maybe just to encourage the parents and maybe the society in general, being like a mental health advocate for these kids, it's very important to really understand and encourage your children, because sometimes if you're not that present parent, maybe your child is even going through these difficulties, but you're not able to even identify them, because for you're just focused on work, or maybe your child has done something, you're called to school, you don't want to know why did they do something like that. It's good to always hear why is in the entire story. Why did they behave that way? Even if you're not going to show the child that, of course you should be a disciplinarian or a parent, but sometimes after you've disciplined the child, it's very important to get to know, why is this child behaving this way? Mm-hmm. Also get to see these patterns. Also get to, if the child is maybe performing poorly, do encourage this child, because people say children don't go through stress, but children do go through stress. Children can have stress because they are the most observant people. A child you see them watching something on TV, the next time they're practicing it. It may be fight, may be like a love affair. They just want to practice something they saw. So it's very important for us to encourage these children and sometimes be present in their lives. And also let's note like things that we are doing around children, words that you're using around children, because they literally shape the behavior that the child can grow up to be, or something you told them that they later on manifest in their adult life. And also it's important for parents to know that some of these disorders are genetic. Like for ADHD, it's somehow genetic. Because if you're a parent with ADHD, high percentage, from like 40 to 60%, your child is going to get ADHD. So sometimes these disorders, bipolar, schizophrenia, they're all genetic disorders. So sometimes it's important for parents to also do like a background check before you like be very intimidating towards your child or something. It's important for you to like know your roots as well, and then be able to help that kid and also support them no matter the season they are at their growth, or you find they have a problem, a neurodevelopmental problem. Sometimes autism, ADHD, there are so many kids that suffer from especially these disorders. It's important for you to take good care of them, because it's not something that can heal. It's something that they have to live with. It's something they have to cope with every day. It's good to shop for them and be present in their life. Also take that step to seek medical or professional help. Don't be afraid to take them for therapy, no matter how young they are. It's good for them. Yeah, I think that's what I can encourage the parents and the community at large. Yeah.
That's very amazing of you. Thank you very much, Catherine, for your invaluable insights. I think now together with the audience, we are now more informed than ever, because it now gives us a broader perspective of what ADHD really entails.